Caring for your baby begins before you even get pregnant. From family history to diet and overall health, there's a lot to think about before you have a baby. Welcome Dr. Cathryn Crosland from Randolph OBGYN. Dr. Crosland, thank you so much for being here.
Thank you for having us.
It's the truth, really. There's so much that you have to do and take care of before you even get pregnant, correct?
That's correct.
When it comes to your health.
Yes.
Starting with taking prenatal vitamins, correct? If you think that you would like to get pregnant.
We like for people to start on them when they're planning on getting pregnant because there are additional nutrients and vitamins that are not in regular vitamins that are in the prenatal vitamins.
The folic acid, I know.
Folic acid is number one, yes, extra.
Okay. There are also some things that you tell patients when they are expecting a baby or thinking about starting a family. You tell them that they need to talk with their doctors about any pre-existing conditions. Can you talk about that and what some of those conditions might be? That's exactly right. Especially diabetes. You need to be in good control before you get pregnant. There have been studies to show that there's increased incidence of birth defects if you're not in good control. Also, if you're on routine medications for chronic illnesses, you need to review those with your physician to see if those are compatible with pregnancy. Hypertension is another one. You want your blood pressure in good control because sometimes it'll creep up as you go along with the pregnancy, and that's good to know as well. That's true. Those are all things you should talk about. Again, you mentioned the medications. What about a tetanus shot? Can you get that when you're pregnant? Yes, and we are now advocating for pregnant women to get the Tdap, which has a pertussis in it as well. Everybody got that when we were children, but over time the immunity to the pertussis wears off, and most people just get the tetanus booster. But the Tdap is very important, and you can actually get it if you're already pregnant. They usually recommend after 20 weeks. It helps confer some immunity to the baby as well. So until after it's born, until it gets a little older and develops immunity on its own. Okay. What about talking to your doctor about any kind of family history of any illnesses and disorders? Is that something that you should be talking about again as you're in the planning stages of your family? Absolutely. There are certain genetic disorders that tend to run in certain groups of people, ethnic groups, and we have testing for that. Cystic fibrosis is one that's very common that we can test for, and that can be done at any time. You don't have to be pregnant, and once it's done, it never needs to be repeated. The other testing, there are genetic disorders such as Tay-Sachs and some of the problems that run in the Jewish population. Those can be detected early as well. What about your weight? What about a woman's weight? Really, it's ideal if they're at a good weight to begin with. Absolutely. It's normal body weight. You would like to have ideally everybody at a normal body weight before they got pregnant, but that's not always the case. So you really need to eat healthy and watch your diet while you're trying to conceive, and then also once you get pregnant, it's important as well. When you get pregnant, how much should you really gain? What's healthy? It depends. If someone's a normal body weight, 25 to 35 pounds is pretty much what we recommend. If you're underweight, you could gain up to as much as 40. If you're a little over, we usually recommend not quite as much, maybe 15 to 25. It just depends. Okay, and can you answer this for me? Because I know so many pregnant women who say, oh, my doctor says I can have a glass of wine when I'm pregnant. When I was pregnant, I did not have a lick of alcohol. I just was freaked out by that. Not a sip, nothing. I just would not. We usually don't recommend alcohol. I've had people tell me that their doctor said, oh, you can have a glass of wine. Right. I think, don't do it. Don't do it. That's what I think. Anyway, can you talk about this binder that you brought? This is something that you give to new patients? Right. When the patient comes in early pregnant for their OB workup, we have a manual that kind of gives them a guide for what to expect and things to look out for, and just recommendations, just some general information. It's very helpful. I usually tell them it's their homework. Yeah, I know. To read up on all that before they come back, and we'll test them on it. It's good homework, though. It's stuff that you should all know. Randolph OBGYN, by the way, has 3 locations. You can find Dr. Crosland at the Cornelius office. The number is there on your screen, 704-895-7224. I'll say it again, it's 704-895-7224, Randolph OBGYN in Cornelius. That's where you'll find Dr. Crosland. You'll also find them on Randolph Road in Charlotte and at the Epicenter. To reach those locations, you can call 704-333-4104. Again, 704-333-4104. Thank you so much for being here today. Great information.